Is the presentation clear to everyone, or are there any technical issues with the screen, doctors? Is it clear at all, or is there a problem? Okay, great. Today's lecture will not be lengthy because the topic requires focus. We don't lose track. Introduce the first point. We will talk about a somewhat important topic, image quality. In our previous lectures, we discussed computer radiography and digital radiography. There is a part related to image quality specifically in X-ray imaging. This part is very important because we focus on it and understand what the image quality indices or image quality parameters are, which allow me to perform an evaluation, and what the factors that affect them are. You will find that we have the process of image quality quantities or indices includes aspects like contrast, resolution, noise, unsharpness, magnification, and some distortions that can be observed, as well as artifacts. When we evaluate the image, this applies not only to X-ray imaging, but also to all imaging modalities. The image quality parameters I am talking about, such as contrast, resolution, noise, unsharpness, blurring, magnification, distortion, and artifacts, are all very important, and we need to understand the factors that affect them and how we create its report. And in fact, there is a part that relies on the radiologist to produce an excellent report for the image. The assessment of image quality includes a quantitative assessment, which is somewhat related to the medical physicist who performs calculations to determine whether the image quality is optimum or not. There is also a visual assessment, which is a subjective analysis that heavily relies on the radiologist, who can quantitatively determine whether the image is correct or incorrect. Additionally, the visual assessment is largely dependent on the radiologist. The topic is about the complex and detailed process involved in determining the image quality, emphasizing that the ultimate goal is not just to produce a beautiful image, but rather to ensure that the image is diagnostic and meets all necessary standards. The integration between the acquisition parameters and a specific design protocol is crucial, and this also relates to the choice of machine specifications from the beginning, which is a critical step in the process. When you set up the machine, you apply the existing protocols and then assess whether the machine is functioning correctly, ensuring that all parameters are optimized for the best possible outcome. Ultimately, this is a decision for the radiologist, and whether the image meets the necessary criteria will determine if adjustments to the parameters are needed to achieve a diagnostic image with the lowest possible dose, ensuring patient safety and image accuracy. I have a range I can work within, and the matter depends on the experience of the medical physicist and whether I have practical experience or with the technologist in setting the existing protocols. When we talk about image quality parameters, we will discuss contrast. In fact, the topic of contrast is very important. The idea of contrast always indicates the difference in a specific object you want to see. Is the object present, or is there a specific lesion? Are you seeing it clearly with a difference in signal or a difference in intensity? Is there a push in intensity between it and the background or not? As long as there is a significant difference between the lesion and the background, you have high contrast. For example, if I have a lesion or a specific object that has a bright signal or a white signal and the background is black, then there is a high difference or high contrast. If there is a significant difference in intensity between the lesions and the background, and if the lesions and the background are both close on the gray scale, for example, sometimes you find things that are above the lesions in the liver if they have an E intensity somewhat close to the E liver, then you might not be able to differentiate strongly between them and the liver or the background. In this case, there is low contrast. However, if there is a stone present in the kidney, the stone is considered an object that provides a high bright signal, while the kidney serves as your background. In this case, there is a big difference, resulting in high contrast between the stone and the background. The process of obtaining the background or achieving the contrast present in the image honestly has many factors that affect it. One of the factors that influence it is the object itself, the origin of what you are imaging, and its attenuation. We are talking about the atomic number and its density. If it is almost big, then there will be 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 almost big. Therefore, the process shows no significant difference, which means your contrast decreases and you start to see that your image has no significant difference between the gray value or the signal intensity of the object and that of the background. As I mentioned, this difference largely depends on the type of object you are imaging, the type of organ, as well as on attenuation, the thickness of the organ or object you are imaging, and also on some acquisition parameters, for instance, how I am using KV, how I am using MA, or how the scan time is set. How does the factor work? Even when we talk in the city, you will find the thickness you are working with has a set of parameters that affect the issue of contrast. You will also find that the type of imaging modality, for example, when I work with screen film radiography, can I achieve the same contrast as with digital radiography or computed radiography? You will find that screen film radiography is highly sensitive to the radiographic parameters, while computed radiography shows some differences. For instance, you will find that screen film radiography has a certain level of sensitivity. The change in milliampere settings cannot easily be addressed in post-processing, but when working with digital radiography, you have the opportunity in post-processing to make adjustments such as enhancing contrast. Digital radiography is extremely sensitive, meaning you will find that the quantum efficiency of digital radiography and computer radiography is higher than that of screen film radiography. Therefore, it is sensitive and can significantly enhance the quality of the radiographs. I brought the same thing that I am imaging, the one I am using. For example, it refers to its effect on contrast and the milliampere settings. The next parameter is the type of detector itself, whether it is screen film radiography or if we are talking about digital radiography. This also affects the contrast in my image. There are also factors that affect image quality, as I mentioned, such as the issue of the image that was produced. Were you able to perform post-processing on it? You can control and manipulate the window level and window width of the image, and you can improve its contrast. If there is underexposure or overexposure in screen film radiography, you cannot do anything about it. However, if you are working with CR or digital radiography, you can make changes known as windowing, and you can enhance the image quality, allowing you to diagnose the image. For example, if I take a normal chest radiography, you will find that you can select a kilovolt of more than 70 to create a clearer image. You can see the contrast very well, and the image appears without issues. Now, if today you increase the kilovolt peak by 15%, you will find that the image has changed, and you will start to see the shape appearing in this way. 15% less means 60 kVs, and you will find that the image becomes underexposed. So what is the reason for in this choice? If I am talking about the difference, I see that it is not significant. For example, if I talk about 70 kV, Increasing or decreasing by 15% usually results in an image produced in screen film radiography, which has a narrow range in exposure latitude. On the other hand, screen film radiography can have a broader range in exposure latitude. The range of my exposure is satisfactory, meaning you can easily reach a state of overexposure and underexposure, unlike in digital radiography, where you have a wide range of exposure. You can lower or increase your KV range and process this in the post-processing, unlike screen film radiography, which has its drawbacks, such as the changes in KV affecting the image quality. You are the one tonight. The image has changed. So what happened? What happened? Because when we came, we increased our input. It feels like the image has become, in some places or in a certain area, that's it. If you come here tonight, you will feel that the image has become like this. When you adjusted the key or increased the parameter, you increased the pressure, as we will see, for example, in the image that illustrates this. Here I am doing imaging. So I use low kV, and high kV. In case you are using low kV, the high kV is fine. But if you are, for example, currently using in this scenario, let's consider a situation where you are utilizing low kV, which stands for low kilo voltage. As a result of using low kV, the quantity of the output or the result will naturally be on the lower side. This is because low kV is designed to operate with lower energy levels, which inherently limits the amount of output it can produce. Now, if we shift our focus to high kV, which is high kilo voltage, the situation changes significantly. High kV is engineered to handle much larger quantities due to its higher energy capacity, allowing for a greater output. Furthermore, when dealing with high-density materials, which are materials that have a higher mass per unit volume compared to the surrounding environment, the implications are even more pronounced. If these materials are present in contrast to the background and the surrounding tissue, and I apply specific parameters or settings, the outcome will be that you will observe a distinct difference in the results. This is because the parameters are tailored to enhance the visibility and differentiation of high-density materials, making them stand out more prominently against less dense backgrounds. If I use, as I said, the penetration coming from the bone and the penetration coming from the fat and the penetration coming from the air, I will have less difference in the transmitted photons coming from the bone, fat, and air because I was using a large period. Thus, I use the intensity of the penetration coming from the fat and air. If I came today and said, no, I will reduce your quality, when you come to reduce your quality, what will happen? Your quality reduction will show that the photons coming from the bone will be low as a result of not using it. If you do not use a high power range for the X-ray, you will find that the background here has significantly changed, and it will start to appear to you. Between the gap, between the fat and between the air, the image appears with this contrast. So if the process of the composition led to what? It led to the presence of this contrast. As a result of higher attenuation, especially with high density materials, there is a significant difference between the transmitted photons or transmitted intensity of radiation and the transmitted photons or transmitted intensity from high density materials and low density materials. Therefore, this difference in attenuation and intensity gives me high contrast or a clear distinction between the high density object and the low density object. However, in the case of using high kV, you increase the penetration power of the X-ray, which significantly reduces the difference between the transmitted photons coming from the high density object and the low density object. That's why the selection process is not just about increasing or decreasing the kV. The idea is to choose the optimum kV value that is suitable for many situations, particularly for the type of origin you are imaging. For example, if you are using it for the abdomen or pelvis, or if you are taking a range. No, this is our picture. For cancer, you need about 75 kilovolts. If you are working on a chest, or if you are working on a lateral chest view. You might find yourself needing to use 80 kilovolts. If you are looking at a chest, for example, in the AP or lateral position, you need to increase the kV because you are in the lateral area. You need to increase the kV because you are in the lateral area. You need to increase the kV, especially when you are looking at the bone area. When you look from the lateral side, in this case, you might need to increase it a bit. For the 60 and large 80, according to the region you are imaging, you choose the optimal value. This can also vary from machine to machine depending on the sensitivity of the machine and the type of machine it is. That's why all this needs to be done at the beginning and the settings for the protocols. As I mentioned, it should be accepted by the radiologist. For me, this image is very optimal, so I want to fix the parameters based on this, but the process of increasing or changing depends on the region or the scanned origin that you want to image. Even in the city is the same idea. When you start working on the city, you might have an origin like the print. For example, if you are using high kV at 120 kilovolts, when you work on the chest area, you can go down to 80 kV. When you work in the abdominal pelvis, if the patient is thin, you can work at 80 kV or 100 kV. If the patient is fat, you can work at 120 kV. For the pelvis region, you can even increase to 140 kV. The change in kV depends on the organ and the patient itself, whether it is a child, baby, or an adult. You always find images that contain a low contrast image. For example, if the image contains high contrast, it means we are looking at the grayscale in the first Hall's image. You will find that in the low contrast image, it's as if I'm telling you what it is. The image that has very high contrast is black and white, or there is a strong difference, meaning you have two signals, white and black, with no gray values in between. So when you increase the contrast significantly, it gives you no number of gray values in between. For instance, now you have a focal lesion present in an area like the liver. This focal lesion has a strong independence. So for example, if you did something like giving a high kV, then this high kV, for example, your work now involves parameters that you want to make visible or clear. In the process of clarity or selecting the parameters that make this clear, you need to first see what you want to observe in the image. This means choosing the parameters that give you the optimal contrast. Here, I can't say that high contrast is better or low contrast is better. It depends on the situation. You are looking for that you are in search of or seeking to borrow and borrow. In some cases, you might want low contrast images, while in others, you might need high contrast. For example, someone might tell you that for a scan like CT renal, you could use low dose CT urinary tract. Why? Because I want to see the stones. The stones are high density, so I don't care if the image quality is extremely smooth or not. They will show up clearly with a distinct contrast against the background. Therefore, I will reduce the parameters. Here, the choice of parameters or factors depends on the type of origin and the type of lesion you are looking to capture in your image. For example, in today's angiography examinations, they use low kV. Low kV is very suitable for angiography examinations because it provides clear contrast. As we discussed earlier, it makes the vessels stand out strongly against the background. Yes, there is noise, but the contrast to noise ratio with low kV is higher than the contrast to noise ratio with high kV. This is optimum for you You have reduced the dose for the patient, while at the same time the image is diagnostic for you. It is not necessary to increase the kV for the image to be good or to decrease the kV for the image to also be good. The story is about finding the optimum diagnostic parameters or optimum parameters that give you the optimum diagnostic image, or the one that gives me OK, F, and this varies depending on the program and the organ I am imaging and whether I am using a contrast agent or not. If I am using a contrast agent, I can reduce the kilovolts because it will give me a high design that does not require me to increase the kilovolts, especially in cases of contrast agents. High kV causes less absorption and more transmission in anatomical tissue, hence less variation in X-ray intensity. The subject contrast is low, resulting in a low contrast image. Low kV results in more absorption and less X-ray transmission with more variation in X-ray intensity. This shows kV levels. We deal with identifying pore silence and see if there is more feeding with less human encoding, but with more differences in humans in the area. The preferred and improved subject is enhanced. The relationship between kilovolts and digital image quality means we are talking about digital radiography. If you are discussing screen film radiography, you will find that it is very sensitive to overexposure and underexposure because I have a short or narrow range of exposure latitude, as we will see later, and I do not have the option of post-processing. However, in digital radiography, as I mentioned, it has a higher quantum efficiency. Thus, its sensitivity to radiation is high. The idea here is that you have the option of post-processing. So if you reduce the kilovolts and the milliampere, it will also affect the contrast. But as I mentioned, you have the ability to manipulate and improve it later, even with high kilovolts. So you have entered into the realm of Compton scattering, as we were discussing. If I have high kilovolts, the photoelectric effect becomes the dominant factor for me. However, with high kilovolts, Compton scattering occurs, leading to scattered photons. What will these scattered photons do? Will they improve contrast or reduce it? They will also reduce contrast. Therefore, decreasing kilovolts will reduce Compton scattering and increase digital radiography contrast, while increasing kilovolts will increase the rate of Compton scattering and thus decrease digital radiography contrast. Also, one of the factors that affect this is something like milliamperes. Milliamperes start to give you a quantity, a number here. More milliamperes means that it increases the number of X-ray photons. And consequently, the users who will be adjusting the devices will be in a situation with more milliamperes than those who will be adjusting with fewer milliamperes. What does this mean? This means that I have now, in a simple area, the image receptor. When a low number of transmitted X-ray photons reaches this area, let's say this area is the background or loading estimator, this area here is also a loading estimator. So, when a low number reaches this area, the burning or blurring that will occur on the film in this area will be minimal. You will always find that if you are using milliampere, you will notice that your background, especially in the soft tissue area, and if you have a bone area, as we will see, it will appear a bit more bright. This means that this area has not experienced complete burning. The X-ray photons did not interact significantly with this part. This is due to using a low number of photons, or low X-ray photons, or low milliampere. On the contrary, if you increase your milliampere, you will find that this background area becomes darker. Why? Because more photons have reached this background area, which will have a greater effect. Translators become translators repeatedly for others. In digital radiography, Using increased milliamperes means, for example, that this image is our original image, and this is my hip joint. If I use a low milliampere here in this image, you will find that the image starts to appear like this, showing a decrease in quality. As I mentioned, you will find that the area I call my background has become more bright, as if the milliampere is not sufficient to create the necessary plating or to deliver a significant number of X-ray photons to the film in this area, which is not enough to achieve the required blackening in the background or to reach the same signal as in a normal image. If you increase the milliampere, you will find that the image starts to appear like this, becoming more blackened. This means that you have increased the density of the emitted image. So, with an increase in milliampere, the image quality improves. The amount of milliampere MA has a direct effect on the amount of radiographic density produced. This topic is particularly significant in film screen radiography, as I mentioned, because you have a narrow range of exposure latitude. This means that even a small initial change, whether in kilovolts, kV, or milliampere MA, will start to have an effect.